Hi, my name is Hannah, and the title of my behavioral change project is Decreasing Self-Interest Behavior in a Child Diagnosed with Autism Spectrum Disorder, an Antecedent Functional Analysis and Intervention Evaluation of Self-Stimulatory Maintained Behavior. The participant within the study was a 7-year-old male who attended day treatment 40 hours per week. He was nonverbal and therefore utilized an AAC device to communicate his wants and needs. Therapy goals primarily focus upon daily living skills and expanding his functional communication. The participant also took medication for hyperactivity as well as sleep-related issues. The target behavior focused within the study was self-interest behavior. Self-interest behavior was defined as striking head with personal hand, fist or open palm in a forceful manner. The measurement system utilized within the study was frequency because the overall goal was to decrease the amount of self-interest behavior that participant engaged in on a day-to-day basis. Reliability was first and foremost gained through open communication between all professionals involved in the participant study. Once a document obtaining the treatment was read and signed by all the individuals involved, that document was then placed within the participant's client binder. Further reliability was increased by introducing an inter-observer agreement. An inter-observer agreement for intervention procedures occurred on 50% of sessions over 39 consecutive days. Agreement was calculated by dividing the number of self-interest behaviors by the number of agreements plus disagreements and multiplying the result by 100%. The mean agreement for self-interest behaviors was 95% and ranged from 94% to 100%. First, a functional analysis took place because previous interventions had little to no success concerning the participant's self-interest behavior. 4 conditions were programmed within a multi-element design, also known as an alternating treatment design. These 4 conditions included sensory, demand, attention, and access to tangibles. And as you can tell, during the sensory condition, self-interest behaviors occurred the least. Based on the results of the 4-phase functional analysis, an intervention evaluation was conducted using an ABA reversal design. Baseline occurred for 10 consecutive days. Frequency data was taken up with a designated clicker for the entire length of the participant's therapy day, which lasted for 8 hours. After 10 consecutive days, the intervention was introduced. During this treatment phase, therapists were instructed to freely, non-contingently give the participant head taps for 1 minute every 30 minutes. Head taps included gentle tappings with the therapist's hands, either closed fist or open palm. The therapist would take frequency data once again on this designated clicker for the total duration of 8 hours. Once the 8-hour day was complete, all frequency data, just like in baseline, was also collected on a data record sheet. Once intervention was done, for those 10 consecutive days, baseline was reintroduced for 10 consecutive days, and then shortly after, intervention was reintroduced for 9 consecutive days. And as you can tell, during baseline, self-interest behaviors were quite high. During the sensory diet, which was considered the treatment phase, self-interest behaviors decreased, baseline increased. Once again, during the treatment phase, self-interest behaviors almost completely disappeared. So once the sensory diet was implemented for a total of 19 days, it was apparent that this participant found success by utilizing the sensory diet. Once the sensory diet was implemented, the therapist also wanted to make sure that the participant was also gaining a replacement behavior for the self-injurious behavior to increase generalization of the skill. So if the participant ever engaged in self-injurious behavior outside or after the free head taps that the therapist gave, the therapist then would 0-second prompt the participant to go to his AAC device and request, "I want head taps," in hopes that eventually the participant would request head taps whenever he felt like he needed some of that extra sensory. So limitations to the study was that there was one participant. It would have been much more insightful if there was multiple participants who may be engaged in a variety of self-injurious behaviors. But nonetheless, it was evident that this participant positively responded to a sensory diet and his self-injurious behaviors decreased, which we wanted to see. I hope everyone had good luck with their behavioral change project, and I greatly look forward to hearing more about yours. Thank you.